We are talking about the Tourette syndrome. Tourette's syndrome. What is Tourette syndrome? Tourette syndrome is a combination of behavioral disorders and tics. Tourette syndrome is a combination of tics and behavioral disorders. Behavioral disorder. The behavioral disorder in tic syndrome is the Tourette syndrome is anxiety, attention deficit hyperactivity disorder, obsessive compulsive disorder, self-destruction, depression, and tics. The Tourette syndrome is usually occur in male. The patient want and trying to suppress this tics, but they fail to suppress this tics. The age of onset of this disease is 2 to 15 years. They mostly disappear in the adulthood in male. Disappear in adulthood in male. What is Tourette syndrome? Tourette syndrome is a combination of tics and behavioral disorders. The tics is normally disappear in the adulthood in male. The patient trying to suppress the tics, but they are failed to suppress these tics. And the behavioral disorder is anxiety, attention deficit hyperactivity disorder, OCD, obsessive compulsive disorders, self-destruction, depression. This is the Tourette syndrome. Tourette syndrome is a combination of behavioral disorder and tics. So the patient trying to suppress these tics, but they fail to suppress these tics. So the age of onset is 2 to 15 years, and the tics disappear in the adulthood in male. And the depressive disorder is anxiety, ADHD, OCD, self-destruction, and depression. The gene responsible for the Tourette syndrome is WC1 gene, CELSR3 gene, and NIPBL gene, FNI gene. These are the genes that are responsible for the Tourette syndrome. We are discussing about the treatment of the Tourette syndrome. The treatment of the Tourette syndrome include the family education, that we will educate the patient that the Tourette syndrome and tics will disappear after the childhood. That is family education, family counseling, and education. We give the drugs and medicine when these tics disturb the patient's life. The medicine commonly used in the Tourette syndrome is alpha agonists, that is clonidine, clonidine. First we start at the low doses, then we will increase the dose. The dose will increase. Other drug for the Tourette syndrome is guanfacine. 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 The dosage of guanfacine is 0.5 to 2 mg daily. The other drug for the Tourette syndrome is neuroleptic drugs. Neuroleptic drugs. The neuroleptic drugs include reserpine. Other drugs include reserpine for Tourette syndrome, olanzapine. We can also give the olanzapine, ziprasidone. Ziprasidone, we can also give the ziprasidone and haloperidol. Fluphenazine. And primidine. We can also give primidine. Because we give these drugs to reduce the risk of dyskinesia. To reduce the risk of dyskinesia, we give these drugs. The botulinum toxin is also effective for small muscle group. Botulinum toxin is also effective for small muscle group. For the small muscle group, the botulinum toxin is also effective to reduce the tics and other symptoms of the Tourette syndrome.